Hi, I'm Rick Thompson, a cardiothoracic surgeon with the Bryan LGH Heart Institute. It's an honor to be one of your co-chairs for our 2012 employee campaign. All of us, employees, volunteers, and physicians, share a common goal to be the best for our patients and for each other. This has been especially evident in the outpouring of gifts to our campaign. I'm going to turn it over to my co-chair to share the details of just how much impact your gifts have had.
I would like to illustrate for you the magnitude of the employee campaign dollars that you gave last year by showing you how Bryan LGH spends a dollar. For every dollar that we generate in services to our patients, 59 cents goes to discounts and charity, and 18 cents is spent on labor, while 7 cents are spent on supplies and 13 cents are spent on other expenses like utilities, service agreements, and so forth. That leaves only 3 cents of profit to spend on new programs, upgrades to our facilities, our IT infrastructure, and other types of new programs that we would like to provide. Well, last year, the $429,000 that you gave to the campaign represents this 3 cents, because that went directly to our bottom line. $429,000 is equivalent, if you work the math backwards, to $14 million worth of new charges that we would have had to have generated for our patients. That's the real magnitude of that $429,000. That's the amount that we were able to put directly back into the compassionate care that we provide for our patients and for each other.
Please join us in this year's campaign. Your gifts will help your coworkers, friends, and family, and our community know that in times of need, we can lean on each other.
I woke up kind of confused one morning, really early in the morning, and the confusion grew, and so Leah ended up taking me to the emergency room. Found out that I had had a seizure and that I did have brain cancer. And when you're 40, people say, no, this isn't your time. You got to get through this. And when you've got a wife and 3 young children who are in elementary and middle school, there's a sense of you got to be there for them. I've got 2 daughters that I want to walk them down the aisle one day. A representative from LifeSpring came to see me in the hospital and asked me to come participate in this program and told me it was all about. At first I hesitated, but I put it on my calendar. I really need to do this, and it was a good way to just get me out of the house and get me interacting with some other people that were going through the same thing that I was going through.
Probably the biggest thing LifeSpring has done is left him with a sense of empowerment.
But to find out that such a program coming and having the opportunity to come and work out and get some education on how to battle cancer and having that be free of charge was very beneficial. There are symptoms, and there's great tiredness and weakness, and I started the program at LifeSpring in spite of all of that. I appreciate the program being there to walk me through that time to get me back on my feet. So to those who have made the donations, to the foundation who made this possible, I thank you.
My name is Nyabirik, and I have a problem with my eye. One eye is not working. Yeah, the doctor say I'm gonna have surgery. If I don't have surgery, I'm gonna lose my eye.
I mentioned to her that we have a caring fund, and that over the years they've been very helpful in difficult situations to employees.
I want to say thank you. I'm not alone. I know I have people with me.
Well, I think it would be very scary to walk into a hospital and not be able to understand the language of the people talking to me, especially if you have something serious going on. We had a mom that didn't understand why her baby had to be brought to the intensive care, and so she was kind of confused. Came down, we were able to use the Marty to explain to her what was going on with her baby, what the baby's condition was, and so she was very thankful that now she understood why her baby was in the NICU.
Hello, Language Access Network. My name is Leon. What language would you like? I've just in the past 8 months been able to get Mandarin Chinese, Ukrainian, and Spanish interpreters, just to think of a few, and they've all done a very good job. In all of those cases, the patients and I have been uniformly happy with the quality of interpretation.
I've seen the relief on the faces of patients when we've used the MARDI to explain what is going on with the patient, and now they understand. I'm thankful to the foundation for being able to give us products like the MARDI that help us improve our nursing care. If we didn't have employees that were giving to the foundation, we wouldn't be able to do all of these things for our patients. My name's Becky Trevino, and I'm a nurse in the NICU here at Bryan LGH.
Many of our patients in the ICU have communication issues. They're also very weak, so it's difficult for them to write, or they can't speak, so writing is their way of communicating. We've had a lot of different tools over the past. Typically, it's been the piece of paper on a clipboard, and that's okay, but what didn't always work for everyone. This is the boogie board, and this is just a little LCD writing tablet. And what it does is it uses a stylet that's very lightweight. And as you can see, you can write a message on here, show it to your nurse, and then when you're done with it, you simply press the button and it goes away and you can start out with a new message. It's amazing when patients can communicate and finally find a tool that they can use. That is so incredibly important. And many of us have never been without a voice. So when you give somebody something like that, it's a huge gift to them. My name is Mona Reynolds, and I am the manager of the Medical Surgical ICU.
I did see the video last year, and there was a young girl on the video, and when I heard her story, I felt like, in just even a minute way, I had helped her. And that's nice to know that I can feel like I'm helping someone and that they have someone to lean on, My name is Christina, and giving back is important to me.
We all need someone to lean on, and your support of the employee campaign does 3 things for Bryan LGH. It helps us secure support from other agencies who often ask, how much are your employees supporting your efforts? It helps us do things that we simply could not do without your support. And then there are some things we do that you help us do just a little bit better. Our community also leans on us. Your support of the United Way and community health charities through this campaign make Lincoln and our surrounding area what it is. You do it through your care, you do it through your gifts. Thank you very much.